So what I did my lit review on was the effects on acupuncture/dry needling during the rehab process in athletes. So acupuncture is an alternative medicine from the Chinese. We now know it as dry needling. It's a more modern name of it. It is a skilled intervention used by PTs. They use a thin, solid, fill-form needle. It is a painless insertion, and it's different than from like a medical needle for like shots and stuff, because those have a pointed end, while this fill-form needle has a ball at the end of the needle. It is a single-use one, so after it's done on the patient, it is thrown away, and is strictly pain-free and allows a small scratch on the skin surface to followed by a diffuse, dull, aching pain. It has helped with neuromuscular skeletal pain, movements, and impairments. So the first article that I found on dry needling that I thought was very interesting would be the treatment of dry needling on a hamstring strain in a collegiate pole vaulter, integrating from eccentric training program. So the purpose of the case report was to present the management and outcomes of a patient with a hamstring strain treated with a functional dry needling and eccentric exercise. So our subject was an 18-year-old collegiate pole vaulter who had been in physical therapy with the acute hamstring strain and had also had multiple hamstring strains before. So he came to therapy 3 times per week and 3 progressive eccentric training and then 3 sessions of dry needling. By day 12, his eccentric training and involvement extremities were greater than an uninvolved extremity, and was reported meaningfully improvement in the outcome scores. So first they did a baseline test on him, and in this chart right here was the selective movement chart. So we have the only one that he really couldn't pass was the multi-segment flexion, which is just bending down and touching your toes. And then the single leg stance on the injured right leg hamstring, he could not do it. So, and then the overhead deep squat, he couldn't do. And then over here, we had the functionals of the dry needling treatment. So here's the 1, 2, 3 treatments. And then the degrees of what they started with, and the degrees of range of motion on how they ended. And this diagram right here is one of the baseline tests we had. So he would try to run straight to the cone, and then loop it back, and then go around the cones, and then finish. So this helped us determine if during the eccentric program of his physical therapy. So within 20 days, he was able to return to sport without any reoccurrence. He demonstrated significant decrease in pain and dysfunction with the dry needling, and he had a greater strength on the injured extremity compared to the collateral previously injured extremity. So, to sum this up, this case study, it had a favorable outcome for the patient with the dry needling. It showed his pain decreased, and it stopped the reoccurrence of another strain. Because once you strain your hamstring, you can strain it more easily than never having done it before. So the second one that I focused on was the spinal and peripheral dry needling versus the peripheral dry needling alone among individuals with a history of lateral ankle sprains. So the purpose of the study was to compare the effects of the spinal and the peripheral dry needling, along with the impairment functions of the performance among individuals with a history of lateral ankle sprain. So they took 20 individuals with a history of an ankle sprain. There were 4 males and 16 females. During the first 2 sessions, the participant completed the foot and ankle disability index and the columbral ankle instability tool. This helped figure out their strength, the unilateral balance, the unilateral hops test, and the performance were assessed to just figure out where they're at in their baseline. So then the patients were randomly assigned to spinal peripheral dry needling groups. The groups were the spinal peripheral and then the peripheral one. This they followed up after their dry needling sessions 6 to 7 days later to assess the outcome measures. Well, the results weren't really that favorable. The peripheral dry needling group showed a significant improvement in the strength, and also the regular the spinal peripheral group did not show much improvement. So there's more research that needed to be done on this article, but overall it still showed that like the balance increased and the strength increased in the patients, and that can always help with any type of injury in athletes. So the next one is the treatment of a subacute posterior knee pain in an adolescent ballet dancer. So this ballet dancer was a 16-year-old female competitive ballet dancer. She was referred to physical therapy for 2 months with a history of a posterior knee pain. They couldn't figure out what was causing it, so then they decided to go in and try the dry needling aspect of it. So what they did is they focused around the trigger points, which is the gastrocnemius and then the popliteus. And so on this picture, this is where her symptoms occurred and where it hurt. So then they focused around this area for the trigger point and then the regions of each of the muscles. So for her baseline test, she had to do a deep squat, a single leg squat, a grand pile, a manual muscle test, and a deep palpation test to figure out where the pain was, how bad it was, how her strength was. So during her deep squat, her pain was limited in returning to a stand from a squat, and then a single leg she was unable to do because of her pain was so high. So the grand pile, the pain was limited during her stand, but she's still able to do it. And then their manual muscle test, so her muscles were fine, but she felt like there was a pulling sensation in her calf muscle, which could lead to straining of the back of the knee. So after her treatment with the dry needling, the subject reported to be pain-free on a numeral pain scale it was a +7 improvement in the previous change in recovery. There was no observation of impairments or functional limitations or normal ability and full strength and unrestricted execution of the dance maneuvers. So she was basically able to do everything that she needed to do in ballet now because she was pain-free and it didn't bother her anymore. So since the patient, she was able to return to a high level of dance training and competition without any limitations, and she resumed pre-injury dynamic movement activities, including dancing, running, jumping, and pivoting without any pain. So the dry needling can be effective and efficient intervention to assist athletes or patients in decreasing pain and returning them to their physical activity. But more additional research is needed to determine the dry needling for other body regions and for long-term possible outcomes, because we really don't know about the outcomes right now. What I've gathered from my lit review is that there's still so much research that needs to be done to figure out if it's just like a short-term improvement or a long-term improvement. So my next article focused on a UCL injury, which is very common in baseball, especially if they're a pitcher and if they're outside of their elbow, which is going to put tension on their UCL. So the purpose of the study was to approach a more conservative management of the UCL injury in a college-age baseball pitcher. They So since this guy had been injured for a while and it wasn't getting better and he didn't want to have surgery, so then they focused on dry needling to see if it would help with the pain. So they stated 6-week post-injury. The interventions including addressing the strength deficits throughout the body, dry needling, and sport-specific biomechanical training with pitching for analysis and correction so that we don't injure it again or so that it doesn't hurt when we throw. So in this table right here, this was the initial elevation. So he was lacking a 10 in the interior rotation. And then at the 12-week follow-up, he was only lacking a 7. So his rotation was able to get better. And then his pain levels decreased tremendously. So he started with a 10 out of 10. And then after one session of dry needling, it was already a 6 out of 10. And then after a week, it dropped down to a 3. And after the 24-week follow-up, it was a 3 out of 10. So for the outcomes of this, it helped his pain scale, and it was a clinically important difference in a minimal deductible after the change over the 12-week treatment. And then the subject he was able to currently compete in his pitching role full time with a 1 out of 10 most pain max that he could have done. So his pain is now a 1 out of 10, which is great. So the dry needling of both contractile and non-contractile tissues in combination of retaining a facility mechanics may encourage chronologically injured ligaments tissue healing and encourage the athletes to return to the sport safely. So the next one focuses on the lateral hip and thigh muscles. So during this case, they used 4 subjects that had chronic lateral hip and thigh pain. They had to go to sessions that were between 40 to 60 minutes long of dry needling, stretching, and strengthening activities over a 4 to 8 week period. So the outcomes were tested at a baseline and upon completion of the therapy. So their baseline, this is where they started right here. So you have your left and then your vaginal baseline. So it kind of it shows like their best was a 20 in this row, and then the current is a 25, and then their worst was an 80. So it dramatically decreased from an 80 to right now current is a 25 in that section. So the lefts in the VAS indicated a clinically meaningful improvement in the disability and pain in the short term and long term follow-up because they waited for 24 weeks, and now we're seeing that dry needling is affecting us in a long term and we're seeing less that it's just short term, so now it's more of a long term effect, and that's what we need because we don't need to send our athletes out to get injured again if it's just going to be a short term effect. It's just putting a band-aid on. We need something that can stay and instead of having to have surgery on stuff. So they're saying that this was a promising outcome for the use of dry needling in the treatments of the chronic lateral hip and thigh pain. But they want furthermore controlled clinical trials are recommended to determine the effectiveness in adding dry needling as compared to other interventions on the chronic lateral and hip and thigh pain. So